Merci beaucoup.
Now time for petitions. Member from Newmarket, Aurora.
Thank you, Speaker. Speaker, this petition deals with a very important healthcare issue in York Region. Addressed to the Legislative Assembly of Ontario, it reads as follows. Whereas more than 850,000 Ontarians live with chronic obstructive pulmonary disease, or COPD, more than 70,000 in Central LHIN, and these numbers are climbing quickly. And whereas COPD is one of the most costly chronic diseases in Ontario, currently responsible for 24% of emergency department visits and 24% of hospitalizations in this province. And whereas respiratory rehabilitation is a Health Quality Ontario endorsed evidence-based intervention that improves the quality of life for people with COPD and other lung diseases while saving healthcare dollars. And whereas due to a lack of dedicated funding for lung health programs, the Respiratory Rehabilitation Program at Southlake Regional Health Centre, the only such program in the Central LHIN, was recently cancelled. We, the undersigned, petition the Legislative Assembly of Ontario to request the Minister of Health and Long-Term Care to urge the Central LHIN and all LHINs to develop evidence-based plans to address COPD and other lung diseases that coordinate resources and care across all levels of the healthcare system. And further, we, the undersigned, petition the Legislative Assembly of Ontario to request the Minister of Health and Long-Term Care to immediately work with stakeholders to develop a province-wide action plan for lung health to improve prevention, early diagnosis and patient outcome while maximizing the return on healthcare investment. Speaker, I'm pleased to affix my signature to this petition, and I trust that the Minister of Health will in fact work with us to address this issue.
Member for